Right now, your fingernails may be displaying warning signs that your body has been trying to send you for months. Signs that most people look at every single day without knowing what they mean. Signs that dermatologists, oncologists, and internists are trained to recognize immediately, but that a standard checkup almost never includes. I am Dr. James, and today I am going to show you 9 changes in your fingernails that can indicate serious underlying conditions, including several that are directly linked to cancer detection in its earliest and most treatable stages. Stay until number 1 because it is the nail sign that physicians consider the most clinically significant and the one most commonly dismissed as cosmetic. Tonight, before you go to sleep, I want you to look at your fingernails in good lighting. What you are about to learn may be the most important 2 minutes you spend this week. Everything I share today comes from research and clinical guidance published in the Journal of the American Academy of Dermatology, the British Journal of Dermatology, the American Cancer Society, and the National Institutes of Health. Nail changes as diagnostic indicators have been studied for over a century of clinical medicine, and the patterns I am about to show you are ones that appear in medical training for a reason. Before we start, look at your fingernails right now. Are they smooth and evenly colored, or do you notice any ridges, discoloration, changes in shape, or areas that look different from the rest? Tell me in the comments what you see. I read every single one, and your descriptions sometimes reveal things worth paying close attention to. Number 9 is nail discoloration, specifically nails that have turned yellow, thickened, and slowed their rate of growth. While yellow nails are most commonly associated with fungal infection, which is itself worth treating, a specific pattern called yellow nail syndrome is recognized in medical literature as a potential indicator of underlying respiratory conditions, including chronic bronchitis, bronchiectasis, and in some cases, lymphatic disorders that can be associated with malignancy. Yellow nail syndrome presents as nails that are uniformly yellow or yellow-green, thickened, excessively curved from side to side, and growing at a rate significantly slower than normal. When this pattern appears alongside respiratory symptoms such as a persistent cough, recurrent chest infections, or unexplained fluid accumulation, it warrants evaluation beyond simple antifungal treatment. A study published in the British Journal of Dermatology found that approximately 40% of yellow nail syndrome cases were associated with an underlying systemic condition, including a meaningful percentage linked to lymphatic malignancies and lung conditions. If your nails are yellow and thickened, and you also have any respiratory symptoms, do not simply assume it is a fungal infection. Mention the combination specifically to your doctor and ask whether further investigation is warranted. Number 8 is nails that have become unusually pale, almost white, across the entire nail bed rather than showing the healthy pink color that indicates good blood flow beneath the surface. Completely white nails, a condition called Koilonychia totalis, or nails with a white band near the base and normal color toward the tip, called Terry's nails, are recognized clinical indicators of several serious systemic conditions. Terry's nails in particular have been associated in published research with liver disease, including cirrhosis, congestive heart failure, and type 2 diabetes. But they have also been documented as a finding in patients with certain malignancies, particularly those affecting the liver and lymphatic system. A study in the Archives of Internal Medicine found Terry's nails present in 80% of patients with liver cirrhosis and in a significant percentage of patients with other serious systemic diseases, making this nail pattern one of the more reliable, visible indicators that internal organ function should be evaluated. If your nails have become noticeably paler than they used to be, particularly if the change has been gradual and progressive, this is worth raising at your next medical appointment alongside a request for basic liver function and metabolic blood work. Number 7 requires your immediate attention if you observe it tonight. Dark vertical lines or streaks running from the base of the nail to the tip, particularly lines that are brown or black in color and that appear on a single nail rather than multiple nails simultaneously. In people with darker skin tones, thin vertical pigmented lines called melanonychia are relatively common and often benign, the result of normal melanin production in the nail matrix. However, a specific type of melanonychia called subungual melanoma is one of the most dangerous and most commonly missed cancers in older adults. Subungual melanoma is a form of melanoma that develops beneath the nail. Because it is hidden, it is frequently mistaken for a bruise, a fungal infection, or simply a nail discoloration, and it is often not diagnosed until it has reached an advanced stage. The warning signs that distinguish a benign pigmented streak from a potentially malignant one include a streak that is wider than 3 millimeters, a streak with irregular or blurred borders rather than sharp, clean edges, a streak that extends onto the skin at the base of the nail, called the Hutchinson sign, and a streak that has appeared recently or is visibly widening over time. Research published in the Journal of the American Academy of Dermatology found that subungual melanoma represented approximately 2% of all melanoma cases, but accounted for a disproportionately high percentage of melanoma deaths, primarily because of delayed diagnosis. The 5-year survival rate when caught early is over 80%. When caught late, it drops to under 25%. If you have a dark streak on a single nail that is new, widening, or shows any of the characteristics I just described, do not wait for your next scheduled appointment. Contact your doctor or a dermatologist this week and ask specifically about subungual melanoma evaluation. This is the one nail sign where promptness genuinely matters. Number 6 is small pits or dents on the surface of the nail, as if someone pressed a pin into the nail plate multiple times, creating a scattered pattern of tiny depressions. Nail pitting is most commonly associated with psoriasis, an inflammatory skin condition, and with psoriatic arthritis. However, nail pitting is also documented in alopecia areata, an autoimmune condition, and in certain connective tissue disorders. In the context of cancer, nail pitting has been observed as a side effect of certain chemotherapy agents, but more significantly, new-onset nail pitting in a senior without a prior diagnosis of psoriasis or autoimmune disease warrants an investigation into its underlying cause. A study in the Journal of the European Academy of Dermatology found that nail pitting was present in up to 68% of patients with psoriasis, but also noted that new-onset pitting in older adults without known psoriasis should prompt evaluation for systemic inflammatory conditions. If your nails have developed multiple small pits or depressions that were not previously present, and particularly if this is accompanied by joint pain or skin changes, mention it specifically to your doctor. Number 5 is a change in the shape of the fingertips themselves, a condition called digital clubbing, where the fingertips become enlarged and rounded, and the nails curve excessively downward over the tip of the finger, giving the fingers a drumstick-like appearance. Clubbing develops over months to years and is often so gradual that the person experiencing it does not notice the change until it is pointed out. The mechanism behind clubbing involves chronic low oxygen delivery to the peripheral tissues, which triggers changes in the soft tissue and bone at the fingertip over time. The clinical significance of clubbing is substantial. It is associated with a range of serious underlying conditions, including chronic lung disease, congenital heart disease, and inflammatory bowel conditions. But it is also a recognized paraneoplastic sign, meaning it can appear as a systemic response to an internal malignancy, most commonly lung cancer. A review published in the New England Journal of Medicine identified lung cancer as the underlying cause in approximately 35% of adult cases of new-onset clubbing, making it one of the more clinically significant nail findings when it appears in a senior without a prior diagnosis of lung or heart disease. A simple test for clubbing is called the Schamroth window test. Place the same fingers of both hands back to back at the nail. In a normal finger, a small diamond-shaped window of light should be visible between the nail bases. In clubbing, this window disappears because the tissue at the nail base is thickened. If you cannot see that window of light, that finding is worth discussing with your doctor. We are halfway through, and I want you to actually do the Schamroth test I just described right now while you are watching. Put your fingers together and check for that window of light. Tell me in the comments what you see. And if this information is giving you something practical to check tonight, hit that like button. 4 more signs to go, and number 1 is the one I most want you to remember. Number 4 is nails that have developed a concave, spoon-like shape, curving upward at the edges instead of lying flat or curving gently downward. This condition is called Koilonychia. In its most common presentation, Koilonychia is a sign of iron deficiency anemia, a condition that is extremely prevalent in seniors and that is itself sometimes a downstream sign of gastrointestinal blood loss. And gastrointestinal blood loss in seniors has a range of causes, including colorectal cancer, that can be identified and treated when caught early. Beyond iron deficiency, Koilonychia has been documented in association with hemochromatosis, a condition of iron overload, and with certain connective tissue disorders. A study in the American Journal of Hematology found that Koilonychia was present in 30% of patients with significant iron deficiency anemia, and noted that in seniors newly presenting with this finding, investigation of the underlying cause of the anemia was clinically essential rather than optional. If your nails have taken on a spoon-like shape, if a small drop of water would pool in the center of your nail rather than running off, ask your doctor for a complete blood count and iron studies. And if those show iron deficiency, ask what the source of the iron loss might be. Number 3 is horizontal lines or grooves running across the width of the nail, parallel to the base, rather than running along the length of the nail. These are called Beau's lines. Beau's lines form when nail growth is temporarily interrupted by a significant physical stress to the body. The nail stops growing, a groove forms at that point, and then growth resumes, leaving the groove to slowly move toward the tip of the nail as growth continues. By measuring the distance of the groove from the nail base and knowing the average nail growth rate, a physician can actually estimate when the interruption in growth occurred. Common causes of Beau's lines include severe illness, high fever, major surgery, significant nutritional deficiency, and chemotherapy. In the context of cancer, Beau's lines are significant both as a potential indicator that an undetected systemic illness has occurred, one severe enough to interrupt nail growth, and as a documented side effect of cancer treatment. When Beau's lines appear simultaneously across all 10 nails without an obvious recent illness or surgery to explain them, this pattern warrants investigation into whether an unidentified systemic condition may be responsible. Number 2 is small red or brown streaks visible beneath the nail, running vertically in the direction of nail growth that look like tiny splinters trapped under the nail surface. These are called splinter hemorrhages. Splinter hemorrhages are caused by small bleeds in the capillaries beneath the nail bed. In isolation and following hand trauma, they are generally benign. However, when they appear on multiple nails simultaneously, without any history of trauma, particularly in combination with fever, fatigue, or unexplained weight loss, they are a recognized clinical sign of infective endocarditis, a serious infection of the heart valves. They are also documented as a perineoplastic finding, appearing as a systemic response to certain malignancies, and as a side effect of some chemotherapy agents affecting the microvasculature. A study in the American Heart Journal found that spontaneous splinter hemorrhages appearing on multiple nails without trauma history prompted cardiac evaluation that identified previously undiagnosed heart valve disease in a significant percentage of cases. If you have red or brown streaks under multiple nails that you cannot explain by recent hand injury, mention this at your next medical visit and ask specifically about cardiac evaluation. And number 1. The nail sign that physicians consider most clinically significant and that is most commonly dismissed as simply a cosmetic problem. Changes in the skin immediately surrounding the nail, particularly the cuticle and the tissue at the nail fold. Specifically, redness, swelling, tenderness, or irregular blood vessels visible in the skin at the base of the nail, alongside nails that have become ragged, peeling, or irregular at the edges. This pattern, called nail fold capillaroscopy, changes when examined medically, is one of the most reliable early indicators of systemic autoimmune conditions, including dermatomyositis, systemic lupus erythematosus, and systemic sclerosis. Dermatomyositis in particular, an inflammatory muscle disease that produces characteristic skin and nail fold changes, is strongly associated with underlying malignancy. Research published in the Journal of the American Academy of Dermatology found that adults over 60 diagnosed with dermatomyositis had a cancer prevalence of approximately 25 to 30%, with the most common associated cancers being ovarian, lung, colorectal, and breast. If the skin around your nails has become persistently red, swollen, or irregular, particularly if you have also noticed muscle weakness, skin rashes, or fatigue, this combination warrants a thorough medical evaluation that specifically includes consideration of an underlying inflammatory or malignant process. 9 signs: yellow nails, pale or white nails, dark vertical streaks, pitting, clubbing, spoon-shaped nails, horizontal lines, splinter hemorrhages, and changes at the nail fold. Tonight, take 2 minutes in good lighting and look carefully at all 10 fingernails. Look for any of these patterns. If you see something that matches, particularly the dark streak, the clubbing, or the nail fold changes, do not wait. Contact your doctor and name the specific finding you are concerned about. Early detection is the single most powerful tool in cancer outcomes, and sometimes the first signal comes from somewhere as simple as the end of your finger. I am Dr. James. Stay sharp. I will see you in the next one.